Walking pneumonia. It's typically seen as a more mild form of pneumonia, and doctors in some parts of Canada, including here in Toronto, say they're seeing a rise in cases, particularly among kids.
So walking pneumonia just is a kind of a layman's term for a pneumonia where you have relatively so-called mild symptoms, and so you're up and about because you don't feel particularly sick. But it is like many other infections, there are years where there's more activity. So this past year or so, there's been increased activity of this particular pathogen, Mycoplasma pneumoniae.
In Canada, it's difficult to measure exactly how significant this surge has been. Public health agencies don't track walking pneumonia, but healthcare providers in Quebec and BC say they too are seeing more cases. In the U.S., the CDC has reported seeing a spike in cases since the spring, especially among toddlers 2 to 4 years of age. Still, walking pneumonia can impact anyone. So what could be behind this year's surge?
And we've seen resurgences of various infections after sort of the lull of COVID lockdowns. It probably has something to do with the level of immunity in the population. So as it wanes, there's going to be more, and then the immunity increases.
Walking pneumonia is a bacterial infection where symptoms can be hard to distinguish from other viral illnesses. It may present as a sore throat, cough, headache, or diarrhea. Dr. Bitnoon stresses that the majority of cases are mild and resolve on their own, but the small percentage of severe cases require a special type of treatment.
One thing to know about mycoplasma is that because it doesn't have a cell wall, regular antibiotics like the beta-lactam antibiotics like penicillins or related antibiotics will not work. So if you're treating for mycoplasma, the first line treatment is a macrolide like azithromycin or clarithromycin. But again, I would reserve those for the ones that are more significantly symptomatic or who have underlying conditions where you're worried they could get sick.
As for prevention, doctors say the usual practices of hand washing, covering coughs and sneezes, and staying home when sick can help stop the spread of the bacteria. In Toronto, Natividad, City News.